It's places like this, on top of a multi-storey car park in Poole, that heroin addicts gather to inject drugs. They can come here without risk of being disturbed, but it's an unclean environment and often unsafe. If you start to overdose here, you can be a long way from help.
It's not a sterile area. It's not an area that you'd want somebody to be performing an injection on you, but these people use up here, these people who use drugs, because they have got nowhere else to use.
But in the battle against drug deaths, support teams in Poole now have a new weapon. This is Naloxone, also known as Pronoxad. It's like an antidote to drug overdoses. It's been around for years, but now Public Health Dorset is funding it without prescription for drug users, their families and carers.
Our evidence shows us that it's extremely effective in bringing people into recovery from their opiate overdose, and it is actually a lifesaver. There's nothing else you can call this medicine. It will save lives if used effectively.
I want you to hold it like this and twist it open. So that's twist number 1.
In cold hard financial terms, this treatment saves money. Each death from a drug overdose costs up to £30,000. Each take-home Naloxone pack costs £5 per year.
And you insert it into the victim's thigh.
The needles in these packs can't be used to inject heroin. So now when drug users come into this needle exchange for clean equipment, they're also offered a take-home Naloxone pack.
It's an amazing opportunity for us to reduce the drug deaths in this area and Dorset, because it's across Dorset. My hope is that when somebody does go over, because they will, is that they're going to have access to a Pronoxad kit, because we've handed enough out.
It's estimated that Naloxone has saved over 80 lives since it was introduced in Hampshire and Reading 12 months ago. These teams will be hoping it can have the same impact across Dorset. Steve Harris, BBC South Today, Poole.
Same on the place, down to the second black line.